10 diseases that kill very quickly. Today, we dive into the depths of some of the most dangerous and intriguing diseases threatening humanity and global health. From Ebola, which defies medical efforts with its alarming mortality, to hemorrhagic dengue, which turns a mosquito bite into a lethal threat, we will explore the origins, symptoms, treatments, and most importantly, how we can prevent these devastating illnesses. But have you ever wondered why diseases such as cerebral malaria continue to be one of the main causes of mortality in some regions, despite medical advances? Or how awareness and simple preventive measures can be our greatest weapon against the global outbreak of avian influenza? And in the face of an increasingly interconnected world, what are the challenges and solutions for controlling the spread of Hantavirus and other zoonotic diseases? Stay with us as we unravel these questions and reveal crucial insights into the ongoing battle for global health. 1. Ebola. The Ebola virus is known for causing hemorrhagic fever, an extremely serious and often fatal condition. Originating in Africa, Ebola spreads through direct contact with bodily fluids of infected individuals or wild animals. The incubation period of the virus varies from 2 to 21 days, after which symptoms begin abruptly. These include fever, muscle pain, sore throat, and weakness, quickly progressing to vomiting, diarrhea, and in severe cases, internal and external bleeding. Treatment for Ebola focuses on supportive symptomatic care, such as hydration, and managing specific complications, given the absence of an approved specific antiviral treatment. Prevention is paramount, involving measures such as the use of personal protective equipment and the practice of safe burials to prevent transmission. Recently, the development of vaccines has offered new hopes in the fight against Ebola, highlighting the importance of continuous surveillance and rapid response to outbreaks to prevent global spread. 2. Bacterial meningitis. Bacterial meningitis is an acute infection of the meninges, the membranes that surround the brain and spinal cord. Potentially fatal, this condition can progress rapidly, requiring immediate diagnosis and treatment. Caused by various bacteria, including Neisseria meningitidis, Streptococcus pneumoniae, and Haemophilus influenzae, transmission occurs via respiratory droplets from infected people. Typical symptoms include high fever, severe headache, neck stiffness, confusion, vomiting, and sensitivity to light. In babies, irritability and swelling of the soft spot on the head may be observed. Diagnostic confirmation is made through blood cultures and primarily by analyzing cerebrospinal fluid obtained by lumbar puncture. Treatment involves the immediate administration of antibiotics and, in some cases, corticosteroids to reduce inflammation. Vaccines against the main causative agents are available and are the primary form of prevention. Immunization is especially recommended for risk groups and in areas of high incidence. Public awareness of the importance of vaccination and early symptom recognition are crucial for controlling outbreaks and reducing the mortality associated with the disease. Bacterial meningitis represents a significant public health challenge, but effective preventive measures and timely treatment can save lives. 3. Toxic shock syndrome, TSS. Toxic shock syndrome, TSS, is a rare but potentially fatal disease caused primarily by toxins produced by certain strains of the bacteria Staphylococcus aureus, and, less frequently, Streptococcus pyogenes. TSS can affect anyone, but has historically been associated with the use of superabsorbent tampons by women during their menstrual period. Symptoms can develop rapidly and include sudden high fever, blood pressure drop, hypotension, a sunburn-like rash, skin peeling, especially on the palms of the hands and soles of the feet. After 1 to 2 weeks, malaise, vomiting, diarrhea, and mental confusion. Immediate treatment is necessary and focuses on administering antibiotics to combat the bacterial infection, along with supportive measures to stabilize blood pressure and maintain vital organs functioning. In cases of TSS associated with tampon use, it is crucial to remove the tampon and avoid its use during treatment and recovery. Prevention of TSS includes practicing good hygiene, appropriate use of menstrual products, and attention to the first signs and symptoms of the disease. Awareness of the risks and symptoms of TSS is vital for early detection and effective treatment, significantly reducing the risks of serious complications and death. 4. Rabies. Rabies is a lethal viral disease that affects the central nervous system of mammals, including humans. Primarily transmitted through the bite of infected animals. Such as dogs, bats, and foxes, the rabies virus enters the body and travels through nerve fibers to the brain, causing encephalitis. The initial symptoms are nonspecific, such as fever, headache, and general malaise, evolving into more severe signs such as hydrophobia, fear of water, intense agitation, paralysis, and eventually death. Early diagnosis is challenging due to the generic nature of the initial symptoms. There is no effective treatment once clinical symptoms manifest, making rabies almost invariably fatal. However, post-exposure prophylaxis, if administered immediately after exposure to the virus, can prevent the development of the disease. Prevention is the best approach against rabies, including the vaccination of domestic animals and community education about the risks of interacting with wild or unknown animals. Awareness and preventive measures are essential to avoid human cases of rabies. 5. Pneumonic plague. Pneumonic plague is a highly infectious and lethal form of plague caused by the bacterium Yersinia pestis. Unlike the bubonic and septicemic forms, the pneumonic can be transmitted from person to person through respiratory droplets. After inhaling the bacteria, symptoms develop rapidly and include high fever, chills, cough with bloody sputum, and difficulty breathing. Without treatment, it can lead to death within hours or days due to respiratory failures. Early diagnosis is crucial and is based on symptoms, exposure history, and, when available, laboratory confirmation. Effective treatment involves the immediate administration of antibiotics, being essential for survival. Control measures include quarantining suspected or confirmed cases and using masks to prevent transmission. Prevention focuses on reducing contact with rodents and their fleas, common vectors of the bacterium. In endemic areas, rodent control and public education on risks and early detection are critical. Vaccination is available for high-risk groups such as laboratory workers and people living or traveling to endemic regions. 6. Septicemia. Septicemia, also known as sepsis, is an extreme body response to an infection, leading rapidly to organ failure and death. This critical state results when an existing infection triggers a chain of inflammatory reactions throughout the body. Initial symptoms include fever, elevated heart rate, rapid breathing, and mental confusion, progressing to septic shock characterized by dangerously low blood pressure. Immediate treatment is crucial, involving intravenous antibiotics, fluids to combat hypertension, and, if necessary, support for vital organs. Early identification of sepsis signs and rapid intervention are essential to improve survival chances. Prevention involves infection control measures, such as hand hygiene and proper treatment of primary infections. 7. Hantavirus. Hantavirus is a group of viruses transmitted primarily by infected rodents. People can become infected through contact with urine, feces, or saliva of infected rodents, or less commonly, through bites. There are two main clinical syndromes associated with hantavirus infection: hemorrhagic fever with renal syndrome, HFRS, and hantavirus cardiopulmonary syndrome, HCPS, the latter being notably severe and potentially fatal. Initial symptoms are nonspecific, including fever, fatigue, and muscle aches, followed by respiratory difficulties and, in severe cases, cardiac and pulmonary failure. There is no specific treatment, cure, or vaccine available for diseases caused by hantavirus. Clinical management focuses on intensive hospital support, especially for patients with HCPS, where supportive therapy may include respiratory assistance. Prevention is based on limiting contact with rodents by maintaining cleanliness in homes, work, and recreational areas, and adopting precautions when camping or engaging in outdoor activities. Awareness of how the viruses are transmitted and preventive measures are essential to reduce the risk of hantavirus infection. 8. Hemorrhagic dengue. Hemorrhagic dengue is a severe form of dengue, a viral disease transmitted by mosquitoes, mainly by Aedes aegypti. It is characterized by increased vascular permeability, bleeding, and, in severe cases, shock, known as dengue shock syndrome, DSS. The initial symptoms are similar to classic dengue, including high fever, headache, body and joint pains. However, they evolve into more severe manifestations such as bleeding in the gums, nose, under the skin, and possibly internal organs, accompanied by persistent vomiting and intense abdominal pain. Early diagnosis is crucial for effective treatment, which focuses on symptom management and fluid and platelet replacement to prevent shock and organ failure. There is no specific treatment for hemorrhagic dengue, making prevention through mosquito control and public education on individual protection measures against mosquito bites essential. Epidemiological surveillance and community mobilization are key to reducing the incidence of hemorrhagic dengue. 9. Cerebral malaria. Cerebral malaria is the most severe form of malaria, caused mainly by the parasite Plasmodium falciparum. Transmitted by the bite of infected Anopheles mosquitoes, this condition represents a serious complication of malaria, where the parasites invade the cerebral blood vessels, leading to significant neurological symptoms. These include seizures, disorientation, coma, and can result in death if not treated promptly. The initial symptoms are similar to those of uncomplicated malaria, such as fever, chills, headache, and malaise, but rapidly progress to signs of cerebral involvement. Diagnosis is made by detecting parasites in the blood, along with the assessment of neurological symptoms. Immediate treatment with antimalarials is essential for survival, with certain drugs specifically recommended for severe cases. In addition to antimalarial treatment, intensive support may be necessary to manage complications and protect vital functions. Prevention focuses on reducing exposure to mosquitoes through the use of insecticide-treated bed nets, use of repellents, and elimination of mosquito breeding sites. Public health campaigns aim to educate on the importance of prevention and early treatment, being fundamental in combating cerebral malaria. 10. Avian influenza, bird flu. Avian influenza, commonly known as bird flu, is a highly contagious viral infectious disease that primarily affects birds, but can, on rare occasions, infect humans and other animals. Caused by type A influenza viruses, various subtypes such as H5N1 and H7N9 are particularly notable for their infections in humans, presenting high mortality rates. Transmission to humans can occur through direct contact with infected birds, their droppings, or contaminated environments, although person-to-person transmission is extremely rare. Symptoms in humans vary from mild flu forms to severe pneumonia, multi-organ failure, and death. Treatment typically involves antivirals, respiratory support, and, in severe cases, intensive care. Preventive measures include proper management of poultry, vaccination of birds where available, and the use of personal protective equipment when handling potentially infected birds. Epidemiological surveillance is crucial for early detection of outbreaks, minimizing the risk of transmission to humans. Public awareness of the risks associated with avian influenza and food safety practices when handling and preparing poultry products are also key to prevention. Thank you for watching. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.